When someone leaves the hospital, their recovery journey is really just beginning, and who's in their corner during that transition can make all the difference. PAM Health has spent nearly 2 decades ensuring that bridge between hospital and home is built on genuine compassion and integrity. Today, we are sitting down with 2 of the people behind that mission. Please welcome to the show Amber Barlow and Whitney Larkin.
Hi.
Thanks for joining us.
Thank you.
Thanks for having us.
We love highlighting PAM Health every single week here on Great Day Live. You're just over the river in southern Indiana. But Amber, I want to start with you. Both you and Whitney started your careers as nurses, and now you work in strategy. So how does your clinical background really shape the way you approach your new role?
For me, my clinical background shapes how I approach strategy because I'm a nurse first. And because I'm a nurse first, I focus on the patient. The patient is the center of everything that we do. And when you focus on keeping the patient number one, everything you do guides you doing that. So I was an ICU nurse for 10 years, and every single day I strive to provide the best patient care possible to every one of my patients. And now that flows over into strategy, because now we create processes, we empower our team so that they can get the patient to the best level of care, which we believe is acute rehab.
And I think that really flows into this next question, because a lot of times when you think business strategy in healthcare, sometimes you don't think of the patient first. And it is so important. You want to give them the best care possible. So how do you ensure that integrity and compassion stay at the forefront?
Like Amber said, we are nurse first. And so I keep in mind, I have a mother that I care for, and that's always at the forefront of my mind. What would I want for my mother? What would I want for my family? I translate that into what does my patient's family want for them? So we use strategy to determine ways we can help and improve the outcomes of our patients. Our patients are not a number. We look at it as the amount of patients we can make a huge impact on. Impact is one of our core values at PAM Health. So it's more about strategizing on how we can empower them to get better outcomes and less about how many patients. We just want the patients to have the opportunity to get the most out of the care with us at PAM Health.
And kind of speaking to that, I mean, after you're out of the hospital, then that rehab happens, and that's where like the scary part happens, right? And so it can be a really vulnerable time when transitioning to that rehab, both on the patient and the families. So why is getting that transition right the first time really important for the recovery and, most importantly, the outcomes?
Getting that transition right is so important. Like you said, it's a vulnerable time. It's scary for patients, for families. They just had a major health event. And so getting them to the right level of care, which we believe acute rehab is the best level of care for recovery. And we really have an interdisciplinary approach. We have our doctors that see patients 5 days a week. We have pulmonologists, cardiologists, nephrologists, and they collaborate with the nurses and the therapists and the case managers to get the patient back where they want to be, back home. And it also starts on the front end with our team, who says, what do you need to be able to do to go back home? And we really tailor all of our care to what that specific patient needs. Maybe it's a 20-year-old that had a work-related injury, or maybe it's a 60-year-old that had a stroke. Really individualizing that care to get the patient back where they belong, back home. And 80% of our patients are able to go back home. So I think that outcome speaks for itself.
I think so too. And I think it really speaks to your why you show up to work every day, why you put the patient first, as you should in healthcare. But what is your why specifically?
My why is all about empowerment. We have a unique opportunity to affect so many people's lives across the healthcare as a profession, across the patients and the families' lives. So just empowering them and knowing that you're making an impact. Back to that core value, which is why I choose PAM Health to carry out my own personal why. I love that they give us a platform to be able to impact so many patients, families, and also nurses across the healthcare community.
So it sounds like PAM Health is just the right choice when it comes to all things healthcare. And you're inviting all of us to your open house coming up.
Yes, we have an open house next Thursday, the 16th, from 4:30 to 6:30 at our New Albany campus. And so we hope everyone can come out for a tour and some refreshments and really educate yourself now on why acute rehab is best. And so when you need it, you're already familiar with it.
And why PAM Health is the best choice in acute rehab.
There you go. Yes, you have two
Absolutely.
locations. You have 2 locations in southern Indiana. You can help the Kentucky folks as well because it's not an ocean, it's just a river that you need to
Yes,
cross on
ma'am.
over
Yes.
to. So anyone in this area can get all the help they need with PAM Health. So
Yes.
we appreciate you stopping by.
Thanks,
you.
Elle. We love
Yes.
being here.
This
All
is
right.
wonderful.
So again, to learn more, just head over to their website, pamhealth.com.